A very warm welcome to everybody. It could be a good morning, a good afternoon, or a good evening, depending on which time zone you're in, but a very warm welcome to all of you. And I wanted to confirm that you're onto the Advocacy and Accountability Roundtable session that is focusing on advancing self-care through policy, national planning, and advocacy. So you're very welcome. So we thought it important that before we delve into the discussion and asking ourselves at what place we are at and what we can learn, it is great to set the stage by defining what self-care is. And based on WHO, it is the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider. And it's very much knowledge, everybody's knowledge, that self-care interventions have the potential to transform healthcare by increasing consumer choice, improving access to health services, and supporting efficiencies in service delivery. We'll take an example at HIV self-testing, where we know that it increases access to testing for people at risk for HIV who may not otherwise test. And when we look at DMPSC, we know that the self-injection specifically, it provides women and adolescents the option of 3 months contraceptive coverage while removing the barriers associated with facility-based care, such as cost, distance, as well as stigma. In addition to making women-controlled products accessible, self-care is about promoting health literacy, as well as healthy behaviors. It's about strengthening individual agency and rights and encouraging community engagement in the healthcare delivery. But we've also learned that over the years, across section productive health programs, we have learned that the best solutions for health consumers are derived with the health consumers themselves. They want a choice, they want a voice in decision-making, and they want to harness their own agency to make health decisions that shape their lives. So with that basic introduction, I would like to to remind us of the fact that WHO released self-care guidelines in June 2019. And this presented an opportunity to countries to begin the process of adapting these to the local context by developing their self-care guidelines and also updating policies that would enable people to practice self-care. And with COVID, that's why we are here in a virtual meeting. COVID is presenting an urgency, and we've noticed that several ministries of health across the globe have taken up the challenge. We know that, for example, Ethiopia, Nigeria, and Uganda, they have begun the process of drafting their guidelines. And we also know that in Senegal is in the early stages. And potentially there could be countries that have begun the process and hoping we will learn about them from this forum. So with that introduction, I want to hand over to Katie to take us through the process of getting to know each other before we discuss.
Thanks, Lillian.
Over to you, Katie.
Thank you. So we're going to do introductions in 2 ways. We're trying to make it feel like we're in the room together as much as we can. So first, if you would use the chat function to introduce yourselves. So your name and affiliation would be great there. And then we're also going to have you use the annotate function to stamp where you're from on this map. Actually, one question for you all, since we weren't in the main group, did you all already introduce yourselves in the chat
No,
box?
we didn't get around to doing that.
Okay. Great. I'm just making sure that that's perfect. Okay, so everyone use the chat box to say your name and your affiliation. And then we'll also ask that on this PowerPoint slide, you're going to use the annotate feature to stamp where you're joining us from on the map. So at the top of your Zoom window, you'll click on View Options and then on Annotate. And then you'll click on Stamp and click the star or the heart and click your location on the map. I see that Beth has already put hers down, so has Dr. Dina. Great to see, I'll do mine. And feel free to unmute yourself and speak up if you're having any problems finding that, and we can help explain. I'm seeing more pop up. I see Shanze.
Katie, I need some help. You said I click at.
Yeah, so if you go, if you use your mouse to hover at the top of the screen, you should see a button that says annotate. Do you see that?
So if you look at the top of the screen and there's a green box that says you're viewing Katie Gray's screen, next to that will be a box that says view options. And then if you scroll down the third from the bottom, it'll say annotate. And if you click on that, you'll then see stamp. And you can click that and then choose a stamp, and then you can put where you're located. And then when you're done, you can X out of it so that you don't end up, stamping other places.
Great. So I'm seeing most people, and we can capture other locations in the chat, but it's really great to see such a geographic spread. I see someone's joining us from Antarctica. It's very exciting. Great, thanks so much. Let me go ahead and save this. And then I will hand it back over to Dr. Lillian. Great. Oh, 1 second. Okay, back over to you, Lillian.
Thank you very much. It's exciting to see that we have people coming in from Africa, from the US, and I think Switzerland. Oh, I could have missed that, but I think that's where the other person is coming from. So I think we'll have a very rich discussion. So prior to delving into our discussion, we thought it important that we share with you, or we agree on our discussion expectations. For example, I think it's only right if we use our hands to raise you use the hand raise function when you'd like to communicate. Feel free to use the chat function to agree and build upon or contribute to what somebody else is speaking to. We are kindly requesting that you mute your microphone when you're not speaking to reduce all the background noise, given that we're working from home or in different places. And it will be so wonderful to see all your faces. So if it's possible, feasible, please turn on your camera. We are requesting that you limit your individual comments to at least 1 to 2 minutes to allow other participants a chance to share. We humbly request that we stay on topic as we have limited time for the discussion. So setting us back, thank you very much, Katie, for sharing this expectation slide. To take us back right into the discussion, I want to start off by saying that it is worth remembering or noting that self-care already exists. But in the past, we know that it has been approached in silos and delivered generally without the input from the health consumers themselves or the health systems that consumers rely on. And what's new in working as we develop our self-care guidelines, we are very deliberate on paying attention to the governance, implementation, and the learning to define the self-care approach. So we know, as we get into the discussion, that a self-care consumer-powered approach to strengthen health systems and achieve universal healthcare coverage is really an uncharted territory. So for us to work together and crack this issue or this nut, we need to be able to share openly and help other countries adapt quickly. So, and this forum is giving us that option and that opportunity. So I encourage all of us to open up and share for those who have done work around this openly so that others can learn and transfer this knowledge on their end. So I wanted to begin this discussion by calling upon the different countries that we know of. We know of Uganda, we know of Nigeria, we know of Senegal that have begun the process of developing guidelines and would like to learn what is happening right now. We want to, as you can, how have the different countries advanced self-care in the past year, either through policy or national programs? Anybody who's willing to tell us how they're going about this? I've seen Uganda on the chat, I've seen Nigeria, I've seen Senegal, so we'll appreciate you speaking up. You can raise your hand, please. Oh, Dina is quick. Welcome, Dr. Dina.
Okay, thank you very much, Lillian, and good evening, everyone. I'm working from home, so you'd bear with my background, and I request to take off my video. So thank you, everyone, for turning up. And just in regard to Lillian's question, Lillian asks how Uganda is faring with the advancement of self-care. And I just want to say that in Uganda, we started on our self-care journey late last year, I think around June, July 2019. And of course, this was together with the WHO. And as the Ministry of Health Uganda, we came up with a self-care expert working group in which we had various partners. We had WHO, we had various CSOs and the private sector coming together to form this working group. It's chaired by the director for clinical services, but also the main Ministry of Health partners are from the SRHR and adolescent health divisions, but also ensuring that we bring on board pharmacy and we bring on board the HIV world and the various civil society organizations that we work with. So for Uganda, it's been an engagement, first with an expert working group, and we've also brought on board a consultant to work with the Ministry of Health to put together our ideas. And we are hoping that once we have everyone's input, we will have a very good guidance, like a self-care guidance for the country. At this particular point in time, we are almost finalizing our draft self-care guidelines, and we hope maybe in the next few months, 1 or 2, we'll be able to enroll these and see how it works in the whole country, and then we can get back for final approvals by the Ministry of Health. So that's our experience. So we are just at the level of sharing, of developing guidelines. Thank you, Lillian.
Thank you very much, Dina. I did hear you speak a lot how you're engaging different partners. The private sector, you've talked about it. The civil society, you've talked about it. Is it possible for the next discussant, yet to see another hand, maybe could hear from Senegal or Nigeria on how they have partnered with the multi-stakeholders within government as they develop the draft guidelines? I see Precious putting up her hand. Precious?
Thank you, Dr. Lillian. My name is Precious. I'm from Uganda. I work with PSI. Probably I will not give you a different context from what Dr. Dina has mentioned, but I thought I would mention a little bit about the programmatic implementation in some of the milestones we've made with advocacy, also in advancing self-care, but with availing products. For instance, recently we had the NDA approve the scale up of injectable contraceptives in private sector, that is accredited drug shops and pharmacies. And we believe that this move will enable access to commodities like DMPA, SC, and encourage self-inject, which is one critical form of self-care, and also an intervention that we hope to ride on really in scaling up other products. There are also other initiatives that are ongoing in country in one way that will promote our advanced self-care. For instance, we have the Ministry of Health working on developing guidelines for the HIV self-testing. We have also seen that we are working with a multi-sector approach really in advancing self-care, where we have the private sector stepping in boldly to support expansion of access to commodities. And I'll give an example of the non-medical outlets where we can access self-care commodities, for instance, condoms. Those ones can be accessed in non-medical outlets. So I think these are some of the other, I would call them programmatic ways, but also results that you're getting from advocacy in Uganda in advancing self-care. Thank you.
Thank you very much, Precious. I see, and it's good to keep broadening what the experience that's coming through Uganda. So I had Christy put up your hand, and as well as Katie. Let's hear what you have to submit about probably the experience in another country. Over to you, Christy, and then Katie.
All right, hi everybody. Sorry, my network is not so good, so I will leave my video off. I'm Christy Aissata, working with Urban Alliance Nigeria. Yeah, our self-care journey in Nigeria started early last year, and we of course started with holding a multi-stakeholder meeting to draw advocacy roadmap for self-care, and Federal Ministry of Health made a commitment to, of course, develop the self-care guideline, the domestic guideline in Nigeria, and that's even with COVID-19, took shape sometime around August, September. There was meeting with different stakeholders, Ministry of Health, of course, the reproductive health units, the health promotion units, Safe Motherhood, were all part of drawing up the self-care guideline. There are other stakeholders like JPIGO, SFH, of course, who was fully, basically really funding that, and WHO, FHI 360, Pathfinder, yeah, just to mention the ones that I can remember top of my head. We're all part of developing the guideline. The guideline have gone through several reviews with the different stakeholders. At the moment, I think last week we just finished costing the costed work plan, and in the next few weeks, that the guidelines should be ready to launch. On the programmatic parts, also been working with various stakeholder and rights groups to implement self-care in Nigeria. Self-care have also been organizing training for youth and also the Nigeria Corp members on self-care, basically generating demand on the self-care services. Yeah, I think that's just in a brief.
Thank you very much.
How far we've got in Nigeria.
Thank you very much, Christy, for sharing us your experience around Nigeria and also Dr. Dina and Precious around Uganda. So as Katie comes in to speak, is it possible for you to help us understand how you have been able to build awareness about self-care? And also, if you could also tell us how you've, in the development I believe for Senegal, how you've partnered with other government stakeholders beyond the Ministry of Health.
Yeah, thanks, Lillian. So I'll speak on behalf of my colleagues in Senegal at PATH, Ami and Ida, who are actually facilitating the French section or session on this topic. So the journey toward kind of the self-care advocacy movement in Senegal started a bit later than it did in Uganda and Nigeria. And I think there was a real recognition in Senegal that there was a pretty there was much more of a need to build a lot of political awareness and buy-in around what self-care is and what guidelines could potentially do to push forward both products and interventions for self-care kind of as a group altogether. And so those of you who joined the advocacy scientific panel yesterday may have heard some of this, but our colleagues in Senegal first started by hosting kind of a series of educational and consultative events where they brought together both members of government, but then also implementing partners who were, who were already implementing programs that had self-care components. So for example, DMPA-SC self-injection, HIV self-testing. They invited some women's groups who were doing a lot of like grassroots mobilization and engagement work. Again, really to kind of just build awareness around what self-care is and what the WHO guidelines contained. And I think my colleagues in Senegal saw a real opportunity there because the government of Senegal had been so committed to scaling up self-injection for DMPA-SC, then that was really that was able to be translated to this commitment for self-care more generally because they had seen the value proposition of self-injection. So after some of these events, they then were able to launch this national level self-care pioneers group is what it's called, to drive forward self-care guidelines. And that group, kind of to your question, Lillian, includes members of government. It also includes some private sector partners, some civil society partners, some partners from the digital health space, as well as some partners actually from kind of the world of NCDs. Which we thought was really interesting that they were really, that community was interested in getting involved in this issue, even though the focus is SRH, because they had some really unique lessons learned to bring to the table from their own health issue area. One question, though, that kind of continues to come to my mind as I work with the team in Senegal on this scope, and I think you mentioned this in your opening, Lillian, is that some countries have jumped right to kind of focusing on pushing forward these guidelines, Other countries, I think, are focusing more on designing packages of interventions, of self-care interventions. Others are focusing on updating kind of individual policies that will advance individual products. I think others are working more on health worker curricula. And I think I'm struggling with, like, how do we prioritize what we focus on first? Like, why are guidelines better than focusing elsewhere? And I think, you know, as we kind of continue this conversation, we'd love to hear from others, you know, what is most impactful, or what would be most impactful, and kind of how others are prioritizing where to put their efforts.
Thank you very much, Ketsi. You bring to table some of the issues I believe that different countries have grappled with in the process of developing their different guidelines. But I just wanted to note in the chat that Fiona from Uganda is saying that they worked with other multiple partners, including the academia, as they try to build the MAIL framework, the monitoring, evaluation, and learning framework for their self-care guidelines. And to speak to what you previously said, Katie, asking how have governments or ministries grappled with deciding where to go. And I see that Beth is posting in the chat, how does self-care for the youth differ? And in our attempt to try and see where to go, it could have presented a barrier to progress on where we want to go. So I'm sorry for calling out Dr. Dina back here, given who she is at our Ministry of Health in Uganda, being that she serves in the position of a commissioner and serving adolescents and young people. I'm going to request that you could probably speak to any barriers to progress as you advance the self-care agenda in the country, the focus on the young people, and also the defining of which interventions or options to package in the guidelines. Dina?
Thank you very much, Lillian. And to speak to barriers, I think one of the greatest barriers I think many of us may experience is self-care, especially in the areas of SRHR for young people. And it's mainly because of our values at the different countries and the cultural beliefs for many of us, where the system doesn't really open up to allowing, for example, contraception for the very young adolescents starting 10 to 14 years. I think this could be a problem for most of the countries on the whole. So this for us as Uganda has been one of the biggest fear and, you know, a barrier that we hope to engage at a later date. And as we do these guidelines, we are looking to see how then shall we ensure that this doesn't mitigate the progress of the self-care journey. And what we have done, we have firstly said that we would look at generally involving the various stakeholders, like the Ministry of Education, who is a key player for that age bracket 10 to 14, and of course the Ministry of Gender and all these ministries. At the point in which we are now, we are not doing very actively with them. We felt that we needed to first understand this as the health sector, and how then can we then tell the other government agencies about the guidance on self-care. So one of the barriers we are looking to see is especially around the young people, and issues around contraception, and especially because the age of consent for most of us is 18 years, and we know that we have such a big constituency around 10 to 18. But that said, we are also looking at barriers like healthcare resistance, healthcare workers resistance. You know, healthcare workers would feel like, so if everyone has to do everything for themselves, give themselves the test and all this, they may be resistant in a way because of they feel that their power to treat and diagnose will be taken off. So this is again something that we are already working with, and that's why we are engaging with the various health workers at different levels in the private and public sector. For example, in the working group, we have someone from the Cancer Institute, we have someone from the private sector, you know. So we're already engaging with them in regard to the fear of what if the healthcare workers resist this. So in a nutshell, we hope that if we come as countries, we already have to start looking at what are the barriers that we are looking to see. And during these expert working groups, for example, we look to see how then do we mitigate such barriers so that the journey to self-care is not derailed. But just to focus again on the question on how is the self-care for youth different, again, it's really around the age and what packages they should be getting. For example, what contraceptive packages should the youth have? So that is the only difference that comes around. But for most of the things, it shouldn't differ so much from the self-care for adults. And as someone said, I think in Senegal, we already had some exposure on DMPA subacute, and we've had lessons from there. So again, it shouldn't be such a big problem. Thank you.
So, thank you very much, Dr. Dina. Erin raises a great question is, would help us understand is that self-care all around contraception, self-injection, and Katie has responded to say that I would say access to availability of information is also critical. So it goes beyond the product, but it's looking at the services, the information, and when you look back at the buckets of how self-care is defined under WHO, it looks at the management issue, it looks at the awareness, and I forget the third bucket, but it looks at another third element around self-care. So it goes beyond self-care, goes beyond. It goes beyond self-injection. It is just because that self-injection has sort of laid the basis for us, and you'll see that multiple people are learning from it, but it is beyond contraception. And we're looking to have it, when you look at WHO's recommendations, they go beyond contraception. Odette asks whether we have slides for this, and the answer is no. This is a discussion, and we're encouraging people to speak up. And Katie does raise an issue about health literacy, and that remains very critical. So it's all right, Odette. So Katie asks our colleague from Senegal, do you have anything to add to what her submission has been? And I think my question to you, in case you're going to respond, is that would you define or help us understand how you worked alongside the consumers as you're advancing the efforts, the advocacy efforts? I think it's Say or Famata or some, please.
Thank you, Lillian. So I can maybe talk about quickly the Self-Care Pioneers group that we launched on July 24th formally, and this was under the lead of the Ministry of Health Family Planning Division. What I can say is that we are really at the very early stages for the self-care, and the aim really of the Pioneers group is to support the Ministry of Health in leveraging, I can say, the self-care, develop national self-care guidelines, building on WHO guidance, of course, and really ensure the input from civil society, the healthcare workers, and users in designing self-care policies. Thank you.
Thank you very much. It is good to hearing everybody submit what is happening in the different countries. Thank you, Nigeria. Thank you, Uganda. And thank you, Senegal. So from this submission, you understand that people are telling us how they're building awareness about self-care, how they're engaging the different stakeholders, which are multiple. And I like the fact that people are bringing out that in government, it's other line ministries beyond health. So education, local governments, because that's where people are living. The community section remains very important, and even civil society. But one thing that is not coming out very well in our discussion is how we are working with the consumers. And are we saying that it is a barrier? That we are, what is stopping us from engaging them as we design, as we come with the self-care guidelines? Are we saying we are facing opposition from the consumer, for example? So can one of us or speak to any opposition that they have faced as they're developing the guidelines? This can be Uganda, can be Christy from Nigeria. You have advanced so far, so it might be great to hear from you how you overcome any opposition that you might have faced as you're developing the guidelines. Christy, can you speak? Can you speak to this, please?
Okay, hi again. Yeah, so I think for Nigeria, the major issues we are having with consumer, it's is even trying to understand the concept. So there have a lot of emphasis in Nigeria on messaging and the need to prioritize self-care messaging and of course make people understand what self-care really is. And in Nigeria, we already have a major issue of self-administration of drugs. So for healthcare workers, I mean, there are a lot of restrictions or lots of resistance from the part because how will they manage the consumers? How will they basically be able to control self-administration of drugs and all that? So I think for us, it's borders around messaging, and we've been trying to prioritize, having to put the right message. And I think that was why for Nigeria, it was important for us to include Ministry of Education. Part of resolution we had in one of our think tank meetings was Ministry of Education has to be a part of this because we have to find a way to properly educate, of course, both the consumer healthcare workers and people in the community what self-care really means. And of course, national professional associations, we're also joined into the discussion. So yeah, I think for us, we try to really prioritize messaging. So by the time we go out, we are giving out the right messages to the consumers and we get, of course, compliance.
Thank you very much, Christy, for that submission. I would like to hear more about if you have faced anybody, Uganda, Nigeria, or Senegal can tell us, if you have faced any opposition from within the health system itself as we are advancing self-care, because we have originally known that we've had a mindset that all my healthcare can only be achieved, appropriate healthcare can only be achieved if I'm in touch with a healthcare provider. And the same applies. So if the healthcare provider is telling people to care for themselves at home, are we taking away what would have called their bread and butter? So I'm checking if any of us has faced that resistance from the healthcare system per se, as we advance the development of the guidelines.
All right, so I'll quickly chip in for anybody. I think the greatest resistance we've actually experienced is from healthcare providers. So yes, self-care is not a new concept, but again, people kind of struggle to understand what self-care really means. And in that process, there were a lot of resistance from healthcare workers, especially, of course, when self-injection was introduced. There were a lot of resistance from them. And that was why one of our major advocacy asks, number one part advocacy asks for Nigeria was that Ministry of Health remove policy barriers which prohibit access to self-care products, like the over-the-counter age restrictions, and all of that. So people can actually have better access to self-care commodities. But I think right now, with, of course, self-care getting a broader acceptance in Nigeria, healthcare workers are beginning to understand what self-care means. And I believe when we start proper sensitization also at the state and community level, this would hopefully be overcome.
Thank you, Christy. And as we try to wind up this discussion around barriers and how we're tackling opposition, Doreen from Burundi, PSI Burundi, is saying from PSI but resides in Burundi.
Oh, Lillian, you just muted yourself.
Thank you very much. Doreen says, which you can read in the chat, that MOH are oftentimes reluctant, especially with regard to client safety during self-care, and are not necessarily up to date in terms of good practices and experiences in other countries. So that's something that remains a big obstacle. And as we get into the discussion on how can we come together and think big and collectively, that how can we work together as this group of community of practice around self-care, how can we begin to push for the self-care agenda? How do we push it forward at national level, at global level, through policies, advocacy, and programming to allow for people to fully utilize self-care? And that question ties into what Shanze is asking in the chat. that following on Katie's question that you brought forward, she's curious to know from countries, again, we are calling out Uganda, Nigeria, and Senegal, regardless of how far you have come, to know from countries that choice, to choose the path of developing the guidelines. What does developing national guidelines enable in terms of broader policy change and implementation? So, and how you went about deciding which interventions to include in those guidelines. So that ties in on how we can drive this agenda forward. So I'm calling upon anybody. I think Uganda, I think, does have experience on how they've managed and determined which strategies, which interventions to include, and how to include them in a more holistic manner, and not having a focus on just individual or siloed interventions. I would call upon if Precious, you can speak to this, please, or Dina.
Thank you, Dr. Lillian. I'm happy to go, and then Dr. Dina can complement. I'll start by responding to the first question that Shanze asks, why we chose the path of guidelines. And we've seen over the years that it's better to have the framework in place that will guide implementation. And having the Ministry of Health lead this process has been very helpful, because they've provided strategic leadership and guidance in how it's best to establish and mainstream self-care in country. And it would be best to start with having guidelines in place to guide practice, scale up, and implementation broadly. And it took us a couple of brainstorming sessions in the self-care expert group, which is a multi-sector group, and like Fiona mentioned earlier, it brings in stakeholders from different aspects of implementation, from academia to Ministry of Health, CSO partners, youth-led organizations, private sector, and we're all in the same room, and we discussed and agreed on the interventions.
I'm giving you 2 minutes.
Sorry, sorry, and the basis mainly was on, one, the interventions that are available in country that are currently being implemented that can be piggybacked on to scale up self-care across the country. Two, the commodities that are available, or those that are being introduced newly into the market, or are being discussed about being introduced in country. So those are some of the criteria or basis that we focused on in deciding or choosing the interventions that should be included in the self-care packages that we include in the guidelines. But again, the guideline is a living document, so we are able to include in more interventions as they come in. Thank you, Dr. Lillian.
So to further tie into what Precious is saying, thank you very much, Precious, is that as Uganda, for example, to have the different siloed interventions as a basis, or to a learning platform, is what the Ministry of Health agenda is. So they're trying to look at self-care as a consumer-powered approach that is intended to strengthen the health systems so that we can achieve the healthcare coverage. So in a bid to do that, we went through a process to determine which interventions we can go with within the SRH bracket. And I think it is potentially we can have further discussions around this detail. And Katie posed a very important question that would tie up our current discussion. Having heard from different ministries or governments what is happening in Uganda, Nigeria, and Senegal specifically, I think the teams joining us from Burundi, from Rwanda, would like to know, as we conclude this discussion, what opportunities do you see for self-care in your varied countries? Because you're here to learn from us. So I did see somebody from Burundi. In 1 minute, you could tell us, and somebody from Rwanda in another 1 minute, you could kindly share with us what you're picking. I do see Katie's hand remained up. Was she saying something, or before the ring comes in?
That's okay. I can wait until after you ask this question to everyone.
Doreen, please.
Yes, thank you, Dr. Lillian. I think self-care in general, and for FP or contraception in particular, it's a great opportunity, to first to increase access, and in some way to free clients, especially for stigmatized services, and especially with adolescents and young people. This is really the opportunity that I'm seeing here in Burundi. And unfortunately, we are facing more a sort of fear or a denial from the MOH, regarding the fact of putting the trust in women's hands regardless the level of literacy. So I think this is where we need to support the MOH to build a really strong system which can really support the clients and beneficiaries in the self-care journey. Yes. And thank you for all sharing Nigeria, Uganda, and Senegal. It's inspiring.
Rwanda? Before Katie comes in, we have somebody from Rwanda. Do you want to speak to this, please? Or in the meantime, Katie, you can go, as we're running out of time.
Sure. So I just wanted to go back to a question that you asked, Lillian, and then also something that Beth raised in the chat. So in terms of barriers, I know that you were asking, Lillian, about kind of what barriers have you seen in terms of consumers' worries. I think something that I've seen across countries is that a group that has the potential to be a barrier are actually health worker associations, and kind of their unwillingness or hesitancy to kind of give up another one of those roles. So one example I can give is our team in Myanmar has been working really closely to help kind of sensitize and bring their Midwives and Nurses Association on board to like get them bought into the concept of self-care, and are now actually working with them to develop a curriculum to sensitize nurses and midwives during in-service training on self-care. So I think that was a good tactic about, or a good tactic to kind of overcome that resistance. But one kind of related point to Beth's question about this denial, you know, I think you said something, Beth, about women have been doing this forever. And so why are we pushing this now? And I think that brings up a good point. And I think just to play devil's advocate for a moment, you know, are we pushing this now because systems are overloaded? Are we pushing it now because we think that it's easier to push a burden onto women than to kind of deal with systemic changes in our health systems? How do we make sure that women aren't suddenly being forced to pay out of pocket for things that previously were free or reduced cost? I think those are all questions that have to obviously kind of be taken into account as countries are developing their policies and guidelines. I also think it brings in the importance of consulting with civil society. I know something that came up in Senegal, for example, during some of the early consultations and educational events we had, were that women thought that much of their reproductive health experience was over-medicalized. And they had a real interest in seeing kind of some things demedicalized to the point that they don't need a prescription for everything, or they don't need to have a touch point with a health worker for an intervention that doesn't require it. And so I think that's a place where self-care plays a really unique role, is the ability to demedicalize things, which I realize is not a term that is popular with health associations, but demedicalize certain things that women are calling for and asking for. Stop there.
Thank you very much, Katie. Beth, during our discussion, Beth points out something very important, and I hope that we can emphasize this point further. That her point was why we are doing it now. The issue is that self-care should be integrated into a continuum of care. And I think that is the push from the different ministries, that it's looked at as an approach and not in a siloed manner. And so that it can contribute to universal health coverage at the end of the day, so that we can achieve it. So Beth, everybody is saluting to what you're saying, and we're all totally in agreement, and I think that should be the direction. Thank you, Dina, for bringing up other key barriers around digital access. And out of this, and also, Martha, not to close the discussion on you bring out something perspective about that unique population, which is the young persons. And Dr. Dina had made an attempt to explain how people are doing it. And that's why our initial discussion was, how do we bring alongside the consumers, and in this case would be that special population of the young persons and adolescents, to work with them to advance the advocacy efforts around self-care. So that is how we are being cognizant of the fact that this is a unique population, and looking at the population dividend in the different countries, demographic dividend in the different countries, the adolescents, you cannot design anything for them without them being included. So we have heard how different governments are doing. We have heard the barriers and how they've been able to tackle any barriers around that. And also we are glad to learn from Burundi that they understand, they are picking areas on how they can improve and advance self-care in the different countries, while being aware of the different barriers or opposition that could happen as they advance this. The whole purpose of our discussion today was to learn from what countries have done and how other countries who are yet to start the process can learn from each other. And I get the sense that we have been able to share that, and other countries are learning on how this can be done. So with those remarks, and also well knowing that time is against us, allow me to hand over to Katie to take us through the closing exercise, so that anything that we could have missed in this discussion is noted, and we can determine how best to improve that. Over to you, Katie.
And I will say I can make my closing very short if Farmata wants to make a contribution. I see her hand up. Farmata, did you want to jump in? Oh, go ahead.
Yes, Katie, thank you so much. I just wanted to add that we have 3 discussion groups, I can say, in Senegal. So one is composed of the group of, how can I say, the civil society, we have the healthcare professionals, and then we have the deciders. And I think it's important to have these 3 groups and to have these different discussions to see how we can align with the guidelines, to see what can be decided, and then how self-care will be implemented in Senegal. That's what's happening currently, those discussion groups. And maybe the other countries, I think, maybe have something similar. But yeah, I think it's like really important to have these discussion groups gather periodically to discuss things, what things can be done. Thank you, Katie.
Great, thanks, Farmata. So before we close out, I see some people are already doing it. We're going to ask you to annotate one more time. So select some type of stamp and place it on the face that represents how you're feeling after this conversation, ranging from disappointed, sad, to very happy and energized. I think for me, this conversation has raised a lot of really great things to think about, a lot of really great country examples, has raised probably some more questions. So I love that someone used the arrow for the arrow symbol. I'm assuming to signal that we have work to do and forward motion setting us there. Great, that's great to see. So I will close that out, and I will hand over to Alicia, who's going to say a couple of things about how you can get involved in a global self-care group.
Great, thank you so much, Katie. So as Katie said, that there's still more work to do, and we know that we're having these ongoing discussions. So for those of you who aren't members of the Self-Care Trailblazers group, I would encourage you to consider joining. We'll link to the website as well as how you can become a member in the chat. And really, we work on everything from advocacy to evidence and learning at the country, regional, and global level. And it's an opportunity to really continue this work. And we will be having a member summit on February 18th to launch our new strategic plan for the next 5 years. And so if you are interested either in becoming a member, or you are already a member and want to learn more about the future work, I would encourage all of you to join. So we will put that in the chat, and yes, just would encourage all of you to look into joining the SCTG.
Thank you very much, Alicia and Katie. Kindly pay attention to the Self-Care Trailblazer group. There's a lot of support that will get us countries as we advance the self-care agenda in our different countries. It provides a lot of global evidence and direction on improvement around quality of care, about learning and framing our research around improving and directing the self-care agenda. So please be sure to get in there. So as we wind up, we began, our focus was around how do we advance the self-care agenda through policy, through advocacy, and through programming. And the whole point was for us to learn from the various countries that are here. It was good to note that a question was posted in the chat around somebody asking, how do I work with the communities? And I was glad to see that even though Senegal is in the early stages of working around developing the guidelines, they had critical input about how we can improve health literacy, which is a huge issue as we advance the self-care agenda. So even other countries, as we're doing a lot of the development of the guidelines, we have important learnings from Senegal, even in the early stages, on how we can improve. So I wanted to say thank you very much for everybody for having participated in this workshop, in this session. And thank you for Uganda, for Nigeria, and for Senegal for sharing your experiences. And I'm glad that Rwanda and Burundi are potential countries and who would like to see self-care advance in the different governments, and are here to learn on how this can be advanced. So thank you very much for participating in this session.
Thank you, Dr. Lillian.
Thank you to our expert facilitator. Thank you.
Pleasure.